Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Dr. David Grand is a licensed clinical social worker with a Ph.D. from International University. He is renowned for his groundbreaking discoveries and advancements in the areas of healing trauma and enhancing performance and creativity. His Brainspotting method and bilateral sound are now used by thousands of therapists on every continent seeking to break through the limitations of talk therapy. Dr. Grand is the author of the book Brainspotting, the revolutionary new therapy for rapid and effective change and emotional healing at warp speed. All right. Well, David, thank you so much for joining us here today.
My pleasure.
I was hoping you could let us know how you got into the work you do and what drives your passion for it.
I got my master's in social work in 1976. So we're going back a long ways. We're going back 45 years. You know, I honestly, I was not clear of my path. In undergraduate, I was kind of lost in some ways. And I took a course I was more pursuing business, and I took a course in industrial psychology. And I found out I was more interested in the psychology part than the industrial part. And that led me to become a psych major. For a variety of reasons, my path into I wanted to become a psychotherapist because helping people is sort of a natural thing for me. But also it was something that I felt I had talent for, and I don't even know why. So as far as the early genesis of my career as a therapist, it's not entirely clear. But I think someplace deep inside, I knew that this is who I was, and this is what I was good at, and this is what I wanted to do.
And if I remember from the book, that somewhere along the line you got fairly good at EMDR, which is known as a technique for trauma resolution. And were you using it specifically for trauma, or were you using it for therapy in general?
Well, I went into it. I wasn't as trauma informed as I was until I came out of it. Actually, doing EMDR revealed that a lot of my clients had deeper trauma than I realized. There was something about the eye movements that just brought that out. But great thing about EMDR is that it gave me tools I didn't have before. The not as great thing was that it was rigidified. And you put tools into my hands and most real clinicians' hands, and we're going to start to experiment with it. We're not going to just use protocols and procedures. We're going to do it in the context of the relationship and in terms of the process. So I started to modify EMDR pretty quickly, especially with the clients that became very dissociative during the process. We were not really prepared for how certain clients would flood and destabilize. And so I started to draw in other things, especially somatic experiencing, which is more working with the body resources and accessing those systems. And so I started to kind of hybridize the relational therapy that I had been doing, the technical aspects of EMDR, but more of the body-based grounding aspect of somatic experiencing. So most people who say they do EMDR are not doing it the way that they were trained, because they found that they needed to make it their own and modify it and bring it into the clinical process, which is not really how it's conceptualized or taught in the essential trainings. And so the question of, are you really doing EMDR or not? If you ask the trainers and the founder, who's no longer alive, the answer is no. What you're doing is not EMDR, because you're not following the protocols and procedures
As strictly as they teach it, right?
Exactly. And to me, this is one of the big differences with Brainspotting. Every Brainspotting training, and the ones that I do, I tell the attendees, said, don't try to do it my way. Find the way that feels right to you, that makes sense to you. Explore it on your own, which is more creative, but it's also more fitting with the clinical process than something that's more strategic in that way. Because if your client makes a left turn when you're expecting them to make a right turn, say, well, you can't make them take the right turn if you want to be attuned. You have to follow them down that left turn and then sort of find out why they went down that left turn. By the time you're starting to figure it out, they've already made a right turn that you weren't anticipating. So the idea of anything that's preset doesn't fit the human process, but it doesn't fit the neurobiological processes that are so deep and so subcortical and so somatic and so unpredictable.
Well, and that's one of the things that you really highlight in your book is you talk about the essence of following your client instead of leading them.
Well, if you lead your client, you're going to lead them to a place that has relevance to you and has much less relevance to them. We call it in Brainspotting getting in the tail of the comet, where the idea is that the client and their process is the head of the comet, and that what we need to do to be attuned is to follow the comet wherever it goes, which means to get into the tail of the comet. We also recognize that attunement is not something you just attain and that's that. For all kinds of reasons, we're always falling in and out of attunement. So the idea is to be mindfully aware of that and to be mindfully aware of the signs that we're falling out of attunement so that we can begin to work our way back into the tail of the comet. But Brainspotting is based on neurobiology. It's a clinical relational process that's based on neurobiology. And the system of the nervous system of the client in front of us having 1 to 4 quadrillion synaptic connections, that's a quadrillion is a billion multiplied by a million, is so complex and is so rapid. Sitting across from the client, whether it's 6 feet across in your office or virtually, from just as we're doing right now, by the time the information hits you, the client is already gone. They're already ahead of that. So that if you think that you can know where the client's at and know where they're going, or even more so leading them, you're not understanding essential neurobiology, which is that all we can do is sit and be present and follow.
So it comes to me as might be useful for our audience to have you talk a little bit about how you moved from just being very involved in EMDR to the Brainspotting. I found that a fascinating story.
Well, actually, by the time I discovered Brainspotting, I had made so many modifications to EMDR that I was no longer allowed to present at their conferences, which shows something about, rigidity and so on. So what I was doing in the EMDR world was not considered EMDR anymore, even though I was using the protocol to a certain degree in a modified way. And I was using a body resource before I was even getting into body activation. And I had really slowed down the eye movements dramatically and developed my own bilateral sound with nature sound that I had engineered to move non-metronomically and a very gentle, fluid way back and forth. When I discovered Brainspotting, I wasn't looking to have my own venue, so to speak. I wasn't looking to break away and have something of my own. And in fact, most people don't know this. If the EMDR world, especially the organizational structure, was open and creative and in a state of evolution, I probably wouldn't have taken my discovery outside of the larger EMDR umbrella. But that umbrella, and the space underneath it was shrinking year after year, so that when I had my Brainspotting discovery, I was out on my own, not even being my own choice, which is actually, in retrospect, a positive thing, because it allowed me to really focus on developing Brainspotting in the way that I felt it really should be, being a relational model, an attunement model, and a neurobiological model all together. But to just the story was, I was sitting with a client who was an ice skater. It's documented in my book, who had was championship caliber, but had many blocks. And we had worked through most of the blocks, virtually all of the blocks, with a combination of SC and EMDR and relational therapy and energy therapy. Even though I wasn't trained in it, there was very much of an energy process to it. But she was stuck on one jump, which was the triple loop. And it was a compulsory jump for either the short or the long program. And because of that, she couldn't really compete. She would jump up, turn around once, twice, and instead of going for that third revolution, She would pop out of the jump and land after 2 revolutions. It has really come into public awareness with Simone Biles and her twisties. Okay, it's the exact same thing. Simone Biles couldn't complete the full revolutions that she needed to because of trauma blocks, and we know some of the trauma, but obviously there's developmental trauma there. So with this skater, I had her just really not just visualize, but somatically feel herself doing the jump, slow motion, and freezing it right at the point where she would pop out of it. And then I did some extremely slow eye movements. Again, this was in EMDR, it's the faster, the better. This is considered not even eye movements, according to Hoyle. And anyhow, I went back a few times and I got right over here and her eye went into this intense eye wobble like this. And I was like startled. And then it froze. And it literally felt like a hand grabbed my wrist and kept it in place there, which is really ironic in the EMDR context because this happened because I stopped moving. It was the fixation on a point of high relevance as determined by this powerful reflexive response that clearly was going down to her brainstem and down to her spine. I was just in the process. But as I held it there, she looked at my fingertips, didn't say, "Why did you stop?" anything. And she just started to watch a video screen and she started to narrate it. And it's like a trauma would come up and process through. And she was describing this in real time. Then another trauma would come up and process through. These are personal traumas, skating traumas, injuries, falls, everything. And then what happened is once that kind of cleared through, that was about 5 minutes, then the traumas that we had worked on before reopened, came up again, and they processed through to a deeper level. And this came sequentially, one after the other, not on a temporal basis, but just they came up by sequence. And then after 10 minutes, it's like her eye just kind of released, everything slowed down, and I just kind of finished up, and that was that. And I knew something had happened. I had a feeling it was big, but I was almost afraid to think that something that profound had happened right in front of me and just what the implications of that might be. And she called from the practice rink the next morning and she said, "David, I just did a triple loop with no problem. And I did it again and again and again." And she never had a problem with that or any other jumps. So it's like, okay, is this what I think it is kind of moment? And so I started to experiment with my other clients. And I was kind of looking for the same thing, but I kind of wasn't because I'd never seen it before. I was looking for sort of analogs of that experience where there'd be a reflexive response, eye blinks or other sort of things. And anytime I saw one, I would stop there, and these clients were used to the flowing eye movements. And I just say, just keep looking here and see what happens. And I saw that it just went deeper and deeper and deeper. And it kind of intuitively, it makes sense that if a person is going to stare at a fixed spot as opposed to a moving spot, that they have a chance to go deeper and really drop down more. And clients would say, "This feels much deeper. I feel it all the way in the back of my head." Talking about relating, literally to brainstem activity.
The physiology, yeah.
Exactly. And I started to see that people went deeper and further and so on. And because a lot of my clients were therapists, also doing processing therapies, I didn't tell them what happened. I would just do it with them. And I'd say, just look, just keep looking over here and watch what happens. And I'd say, "Okay, just tell me what happened," and I'd explain what happened with the skater. I didn't say go out and try it with your clients, but of course, good therapists.
Some did, right?
All did. Good therapists are experimental because that's what therapy is, an experimental process. It's trial and error. You don't never do anything knowing what the outcome is going to be. You do it because you have a sense there's going to be a positive outcome. But where every session, there's trial and error, rolling through the whole time, even though we don't conceptualize it that way. And they would come back and they say, "I saw stuff with my clients I haven't seen before." And that was in 2003. I was 18 years ago. That was really the genesis of Brainspotting.
And it builds on as almost all of us know who've done this kind of work, we take a training, it's a good training, and then we start adding our life experience and our clinical, intuition to it. And then if we're lucky, our clients or patients start teaching us in the process. And so at this stage of the game, how many people have been trained by you or your trainers for Brainspotting?
Well, in the first few years, I was the only trainer, and I was doing trainings in the United States and outside the United States. We did one in Buenos Aires and one in Berlin. And because I had developed relationships around the country and around the world, when I discussed this and after I developed the training, many people were interested in having me come in to do the training. And then after that, I started to develop other trainers because I couldn't do all of them. At this point, the phase 1 and the phase 2 trainings, the introductory and then the more advanced trainings, I don't do anymore unless it's a very special occasion. I do advanced trainings, 3 advanced trainings for people who've taken phase 1 and phase 2. I kind of have lost track of exactly how many people we've trained, but we've had trainings in every continent and countries all around, South America, Europe, Africa, Asia. I'd say we've trained over 20,000 people, at least 20 to 25,000 would be my guesstimate.
So what are you doing in your model and your training to keep it from getting to the rigidified, one size fits all approach that you found happening with EMDR? Well,
you're giving me a platform to stand up on and to start spouting from, so I'll try to not spout. I noticed from social work school field placements in my first jobs that something got lost in the organization, that the original purpose, which was to serve the client, ended up evolving into or devolving into preserving the agency or, the organization. And I think it's a natural thing that happens, and it's a way that focus is lost. But if you have a training modality and you have an organization of the training modality, unless you have a strong philosophy about it, and unless you work that philosophy all the time, things start to get rigidified. In reality, everything in nature is moving all the time. Molecules, subatomic particles, energy, everything is always moving. So nothing stays the same. And yet we come up with healing modalities, and then we tend to concretize them instead of recognizing that whatever it is today, it has to be something different tomorrow and the day after tomorrow. It's not part of the philosophy of most therapies and most modalities. And then when it gets into an organization, then you start getting this stratification, and then the movement and the evolution is gone. And the original purpose, which is to provide the best healing you can possibly provide for people, which is still kind of inside of us, but on a functional basis, it becomes less important. I never said, well, when I have my own organization, I'm not going to do that, because I never thought I'd have my own organization. But as this evolved, I made sure that we did not get that structured. Brainspotting for what it is with 80 trainers around the world. And now we're, getting consultants, probably 100 consultants. It's the most natural thing to go into a bureaucracy with it. And one thing people criticize is that Brainspotting as an organization is not organized enough. Well, to me, it's more of a organic community than it is an organization. And we have a certain amount of, structure to it, but I've kept it to a minimum. If a person takes phase 1 and then they see I'm teaching a phase 3 and they want to take the phase 3 because they're not going to have a chance to take it with me for 2 years, we don't say to that person, well, you have to take phase 2 first and then take phase 3. So forget about coming to phase 3. It's an open model. It's an expansive model. It's a permeable model. What fits the modality has to fit the organization. And I've put my imprint on that. As far as marketing goes, you'll find there's some level of marketing with most organizations and modalities. That's kind of natural. You want people to know about what you're doing and to be drawn towards what we're doing. We do not have a marketing department. for brain spotting. We don't do any marketing. I'm here talking, people are listening. That's part of how we spread the word. But the purpose of brain spotting as a modality and the trainings is not to get the most number of people to come to the trainings. That's the natural marketing approach. That's the profit motive. Well, we don't want to exclude or turn anybody away, but we don't want people to come based on the strength of our marketing. We want people to come based on the strength of the model. And that word gets out from therapist to therapist in each country and around the world. And that model gets out, that word gets out among the client population. And in fact, there seems to be, you talk about energy, there seems to be some flow of energy among people who've received brain spotting as clients, that the word just gets out, and then people end up finding out about it that way, more even from clients than from therapists. So when you don't have a marketing strategy, and yes, we do fine financially because people come because of the quality of the modality and the quality of the trainings, so people come. But when that's not our primary goal, the primary goal is to provide the best healing tools to the people who come to our trainings, and for those people to then go and bring the best healing tools they can bring to the clients for their healing, which is the goal in brain spotting, so that clients will receive the best healing they can possibly receive. That the fact that this is what, as long as I'm in charge, and as long as I have influence, this is the way it has been and it will be, is not a philosophy or a mindset that you'll find. It just is, people don't even think about it in other modalities.
Well, and as I read the book, you said a number of different times that you view the brain spotting as a tool to use and to be blended with whatever other tools the therapist uses in a relational model. And as you're talking about being in the tail of the comet and following the patient or client wherever they go. Mm-hmm. And yet I asked the question I did because I know from my experience in the field after 47 years of taking different trainings like this, it's very common to go to a training and be surrounded by people that think this is it. We have found gold. This is all we need to do anymore is, the EMDR or the CBT or, the EFT tapping and they want to make it the be all and end all. And I was very appreciative of in the book how you said very specifically, this is a tool. This can be part of what the toolkit that you as a therapist have and develop. And you encourage people to be creative with it the way you were creative in coming up with it.
Right. And again, in models tend to not encourage creativity. Models tend to encourage compliance. That's just the nature of things. So I've really very specifically made sure that brain spotting doesn't follow the ways of other models. But just to give a little bit more background to what you're talking about, I knew that with brain spotting, especially as I developed it, that it provided certain healing that for the most part was not out there. But I also knew that it wasn't the only thing that provides healing. And so what I wanted to do was to fill that area that was so important, which is in a relational context, getting access to the deep neurobiology through eye positions and eye reflexes. So I put the focus on developing that. The idea of what EMDR brings, SC brings, IFS brings, all these other things. There's no need out there for me to develop that kind of stuff. It's already out there, and it's highly evolved and highly effective. So for me, I wasn't trying to bring out something that would replace everything else. I was trying to bring out something that would augment everything that's out there. But I also had the philosophical and the scientific underpinnings that I believe should apply to every psychotherapy. I make that as an offering. It's not, anything else. In other words, the uncertainty principle in brain spotting posits that if you're sitting in front of a person with a system of 1 to 4 quadrillion synaptic connections, you are by nature sitting in a state of uncertainty. And the idea that you can take history and then form a diagnosis and have a treatment plan and have that be really workable in the context of the infinite connections in front of you it's unscientific. It goes against brain science. I'm not saying that history taking and diagnostic thinking and treatment planning has no value, but it has to be contextualized in the neurobiological imperative of what's of the person sitting in front of you. And that if you go in with any kind of information in your head, you're going to be listening to that information to the degree that you're going to be listening to your client less. But if you're sitting there and you have embraced uncertainty, you've surrendered to it, you'll be much more able to recognize that the information you have about the client can only come from the client and come from the client's process. Now, I think that should apply for every psychotherapy. That's not a matter of, well, you use eye positions and you use the setups and this and that, because it's to me, it's the neurobiological underpinning and imperative of psychotherapy. But again, and you don't have to integrate that. You either recognize that or you don't recognize that. And then the context that the most important part of the healing is the relationship, the attuned presence of the relationship between both people. Okay, that's another core tenet of Brainspotting. That to me applies for all psychotherapy, whether it's a part of the therapy or not a part of the therapy. So you can't integrate an uncertainty model with a certainty model. Okay, they're not integratable, but you can do EMDR or SC or IFS from the uncertainty model if you understand that, and that will make you much more inclined to listen to and follow your client than it will to listen to your own training, your own experience, even your own wisdom. I'll tell you a story. I got tons of stories, so I'll be selective about it. I did a lot of humanitarian work up in Sandy Hook, Newtown, Connecticut, and I would go up once a month and see clients on a Friday and a Saturday. And I also trained the staff there as well as some other local therapists in Brainspotting. So this one woman, she was an art therapist. And again, we're open to people who are in different therapy modalities, had been struggling with this one client and struggling using Brainspotting with her. And she asked if I could work with her and she could sit in. So of course I said yes. Woman sits down, she starts talking, and I just started to do SE with her, flat out SE. Yes, I was aware of where she was looking. I didn't even call it to her attention.
And the SE is somatic experiencing for people who might not know.
Yeah, thank you.
Getting them to really, you're reading everything about the physical response. And
following it and helping the person to attune to it and all this. So here, this woman who was waiting to see the discoverer of Brainspotting show her how to do Brainspotting with this client. I just flowed into the SC that I had been trained in, because to me, that's how I was attuning to her, and that's how I was following her. I tell that story because, if the head of Brainspotting can sit down and do an SC session, it's because I wasn't concerned with doing Brainspotting or teaching this woman. I was concerned with bringing the best healing I could to this woman. And that's what came out. The integrative nature that we have in Brainspotting is not that you're supposed to do Brainspotting or you're supposed to integrate Brainspotting. It's you're supposed to be present with the person in a way and respond to them in a way that promotes their healing the most, no matter what it is. Okay. And I couldn't care less about doing Brainspotting as opposed to bringing the optimal healing to a person who has been waiting for it for days, weeks, months, years, and decades.
Wonderful. That's just puts me to mind of the old adage that, Jung said, "Thank God I'm young and not a Jungian."
Perfect.
Yeah, because I when I get that solidified, when I get so rigid, I lose effectiveness dramatically.
I'm changing and evolving all the time, and I've been doing this for 45 years, and I'm learning and growing as much as I did at any point in my career.
So have there been significant changes in the way you do or present or teach Brainspotting in the past 10 years?
People who train with me and and then come back and train with me again. Some people repeat a phase 3, a phase 4, a master class. Will say when they come back after 2 or 3 years, it's like you're teaching another modality. What you're teaching and how you're teaching it is significantly different. I like to say that if you're not moving forward, if you're staying in one place, you're actually moving backward. And we have to be evolving. I'll push the point even further, and I write this in the afterword in my book. Brainspotting is temporary. Brainspotting's not meant to be here forever. Brainspotting is here as long as it's meant to be here, as long as it's needed to be here, until, whether inspired by brainspotting or something else comes along that actually it brings more effective healing to clients. So the goal is not to have everybody train in brainspotting. The goal is to evolve, and to evolve to a point where ability to bring healing to people supersedes what it is now, and certainly what it was before. So you're not going to hear the head of any modality say that their modality is meant to be temporary, time limited. Again, that shows the philosophy of it. And it's the philosophy that we sit in front of our clients with and sit with them with, so that anything is possible, as long as we don't, get in the way with our narrowing of our perspectives or trying to use technique to bring about healing that can only happen inside the person.
To take that phrase, to bring about the healing, can you say a little bit about your understanding of the dynamic that brain spotting accesses that triggers that healing response and what that's like? You have significant understanding about brain structure and functioning. And how do you conceptualize the healing that takes place within a brain spotting session?
Well, so far in everything I've talked about, I haven't talked about eye positions, or very little about eye positions. And in the context of the relationship and the neurobiological awareness, we have found that where you look affects how you feel. It's not an accident because, again, the retinas and the optic nerves are made up of neurons. So vision and information processing in the brain are inseparable in certain ways. But I actually noticed early on when you were thinking of asking a question, you were going like this. Your eyes were compelled to go up in that direction. Even your head went a little bit with it. And there's nothing random about that. But because it's something we all do all the time, we don't really notice it or pay attention to it. And this is another thing in terms of integratability. Any therapist who hears about this aspect of brain spotting, we call it gaze spotting, the natural gaze that happens at certain points just in life, but in a therapy session, to notice that and then to point it out to the person and to encourage them to look there. Whatever they were accessing by doing this, instead of just continuing to move the eyes around, they're going to continue to access it. And there's nothing of a conscious, thought-based, language-based aspect to it. It goes right, passes by the neocortex, the human thinking brain. It goes right into the subcortex, the limbic mammalian brain, and the reptilian, autonomic brainstem, and I think down into the spine. So to notice that and to have the person keep looking there, and then to have them just mindfully observe wherever things go for them. We call it processing and processing therapies. That something happens differently than if you didn't do it that way. And it's noticing and honoring and accessing whatever that process was that brought the person's eyes up there. Another one, and we use pointers because you can't keep your hand and your arm raised more than a few minutes. Another thing is when a person is activated around an issue, they say, this is what I want to work on today. We make sure that they're activated and aware of where they're holding the activation in the body. What we then do is, goes back to that original discovery, as we slowly go across the visual field, looking for reflexive responses. You'll see a person all of a sudden goes like this, or a person's head goes back, or they go over here and they go, or they go here and you start to get rapid eye blinking, or you go over here, person bites their lip. You keep going. They don't bite their lip. They just bite it right on that one spot. Each of those spots, the reflexes that we're seeing from the person whose system is activated is showing that there's something there. The fact is we don't know what it is, and we don't have to know what it is. But if you see some real significant reflexes, and sometimes even the subtle reflexes, if you just stop, come over here, the person starts blinking and a little cough. And now I'm doing it to myself here, like I'm the client, but and virtually we do it on the screen. Person goes into a processing, and whatever they're held in place at the place where that reflex happened. So there's a much deeper, more focused, organized processing that's going on for the person based on this eye position. The other way, and this we call outside window because it's looking into the eyes. Inside window is you look to see where the person feels it the most. And you go between on this side, in the middle, or over here. And the person says, oh, it's much more, go back over, right over there. And then we go vertically. You feel it more above eye level, at eye level, or below. Persons go up. No, a little lower, right there. People literally direct us. How do they know to direct us? It's because of the somatic activation that they feel, whether it's tightening in the chest or increased heart rate or respiration or something in the stomach, that they're giving us the feedback that there's something about this eye position where they have greater activation, where they feel it more, which means that they have greater access to whatever is deeper down. And then the person will just continue to look here and go into this processing and follow. And we follow them wherever they go, and we keep track of it. Periodically, we'll take them back to the issue that they're working on and have them bring it up so that they and we can have a sense of the effect of the processing, which sometimes is subtle and sometimes is dramatic. But what I'm saying with all these things with the eye position work is that anybody who does this will find that certain things happen that wouldn't happen otherwise in the same way. And sometimes in the depth and sometimes in the rapidity of it. And that this is a component, and there have been other modalities, that have used eye positions before, but never with the attunement and never with the comprehensiveness that Brainspotting has. This is something that should be part of every psychotherapy. That doesn't mean everybody should come and study Brainspotting. So everybody should understand the relevance of eye positions to the human experience, the neurological experience and the personal experience. And somebody comes along and tells me about something that they find effective. And it's not what I'm doing. My initial response is curiosity and then hopefulness. Because if there's anything I can add to what I'm doing or even replace what I'm doing with, that helps me to be more effective with the people who come to me for healing. I'm all in on that process. So the relational attunement, the being present, following clients where they go, should be part of every therapy. And if it's not, I think there are some design flaws in that therapy. But this aspect is something that helps. As experienced and knowledgeable as a therapist I am, there's a lot of things I can do using eye positions that I couldn't do if I wasn't using them.
Well, I mean, as you say, there are certain trainings like the somatic experiencing or the sensory and motor psychotherapy. Many of us would hope that becomes a standard part of basic clinical training, that we learn to tune in more to the person who's sitting in front of us and understand that this is an energy system and it's all connected. As a foundational piece, there are several observational and following and connected pieces that one would hope are the foundation of any therapy training. We know they aren't yet, but we hope we're getting there.
But if you look at graduate school, not so much. But just the fact that there's a bit here and a bit there is improvement from what it was. But this should be foundational. I was trained in depth psychology that didn't have any awareness of body processes. Nowadays, that's ridiculous. But the prominence of the body experience as a way to access the human experience and the neurobiological experience. There's no other way around it.
Right. So it's the most direct way. It's right there in front of us all day, every day.
Yeah. Yeah. By the way, in terms of energy therapy, I'm not an expert on energy therapy. I have some training in it, some experience, but Brainspotting to me is very much an energy therapy and can be fully integrated with any and all energy therapies. And again, there's no need for me to have to do that work, because people take what they have and they take what Brainspotting brings and they bring it together. They're fully complementary and even synergistic.
Well, and that's what I like about, the more creative, the more really effective therapists that I've seen work, they are blending these things. I've seen therapists, the RTR approach, his name's escaping me, but I've seen him be in the middle of a hypnosis session with somebody and have them start tapping, EFT tapping. And just no hesitation to blend eye movements or EFT tapping, or as you were doing in the one example, start out, and what dawns on you is somatic experiencing is what's going to help this woman the most. Mm-hmm. So that's, many of us have found for years, that's the most effective way to approach something, not through a model, but through that connection with the person you're sitting in front of.
Yeah, we call it the frame, the relational frame. In other words, the client has whatever brings them to therapy, and it's got to be a lot for somebody to actually seek out the help of a therapist and to open up and to have to pay for it and commit to the time. That's their frame, okay, that they bring in, and they walk in and they tell us about it and they hand us the frame. And we don't hold their frame, we hold their frame with them, okay? That's the relational frame. And there's something about that frame of the person, us being with them and them being with us, that creates, a space and creates an energy that things happen in that wouldn't happen, that haven't happened otherwise for the person. So for us, it's in Brainspotting, it's the frame, and which is a context, and then we call it's a neuro-experiential process that comes up and then comes into awareness and then sort of flows out.
It comes to me to say that you were talking about a couple of examples, and we should just tie this together for people, that what we've experienced with this kind of work is that as somebody starts to access and then process, often there's not a whole lot more for me to do as a therapist except hold that space, witness it with them. A lot of people who are listening to this might think, okay, so what do you do after you see all those traumas, like the skater you were talking about? And just say a few words from your perspective about what happens when the person accesses that information.
Well, the Western philosophy and ideology is something happens because you make it happen. Eastern ideology is more something happens because you are present with it and you notice it and you let it happen. You follow it. So this is much more of an Eastern approach. But when you say, well, if you don't really do too much or have too many outside interventions, it takes a hell of a lot to really be present with a person and to stay with them and follow them, and especially when there's so much trauma involved, and it's not only their trauma, but it's generational trauma. And each of us as the therapists are carrying our trauma. So to be present with a person takes a lot more than to be active with a person. And to follow the person means you're surrendering, what you know. You're surrendering your, perceived control of a process. And it takes a much more evolved therapist to do that than to be thinking that the answers and you're going to, bring the answers to the person.
So resolution happens when people start accessing the deeper experience, the memories, the connections between that and what's holding them up in their present life. I don't have to do anything to fix them once they go back and perhaps integrate, re-experience, get access to those energies. And I know a lot of times, especially when I'm working with somebody, they'll say, well, now what do I do? And the answer is stay with that.
Yeah.
Write about it.
Yeah. Resolution is not a destination. It's a process with no end, just like life is, just like energy is. We know that the human system has the genius of self-healing. And we know that on a psychophysiological basis, traumatic experiences create blocks or unprocessed experience in that human system. And that the genius remains in the person. And it's for us to be with a person in such a way that their system's genius can take over and find the blocks and process the blocks and bring permeability to the blocks. And that which is unprocessed can be processed, in real time as you flow into the future.
So if you think about it, if we're wrapping up, we have just a few minutes left. Is there an aspect of your work or the brain spotting or therapy in general that I haven't asked you about that you want to make sure you get out there?
Well, I could go in a few different directions. I do want to say that for people who have the most profound of traumas that start early in life and go on throughout their development, where their systems are not able to have sufficient attachment, so they also have higher dissociation quotients. It's not a disorder, it's just a natural response pattern. Brain spotting is very effective, but it's not a miracle cure. These people still need long-term therapy, and the relationship is the foundation of it, despite the brain spotting tools that you use. So that, yes, if someone has a car accident and it's not sitting on top of a complex trauma network, in 3 to 5 sessions, you may help them to be free of the symptoms of that car accident. Most of the work we do with people is more complex. And so there's no miracle cures, and that healing takes time, no matter how effective any modality, including brain spotting, is. I want to also just sort of cite that we use brain spotting also for performance. And performance can be for an athlete, or it can be for a stage performer or a writer. But performance also goes, we have the performance of everyday life, to paraphrase Freud. And that literally how we walk through our days in terms of what we do, how we relate to others, what we have to do, what we try to do, is all in the element of performance. And it's not easy to change performance blocks. But what you do is you use that as the pathway for healing. So when you do performance work, and I'll work with athletes and actors and so on, and they get more healing out of it than anything else, it's always about the healing. And whatever we do in brain spotting and other modalities and integrative modalities, it's the one focus we have is promoting the healing process with people.
So you would direct people to, is it just brainspotting.com? It's a primary website for this?
Brainspotting.com. My book is on Amazon. There's a bunch of stuff up on YouTube. The most basic one, clearest one is What is Brain Spotting on YouTube. So, and people have plenty of websites up there. So, brain spotting has evolved and spread internationally, so much.
Well, I greatly appreciate your taking the time to be with us and share your work. And if you have another creative genius moment and come up with something even better by leaps and bounds, please let us know. And
if you do, please let me and everybody else know.
All right,
because it can happen for all of us.
Yeah, we don't know when that's going to pop in, but right. Well, I greatly appreciate it. Thank you so much. It's a pleasure talking with you.
Thank you. Thank you.
Dr. David Grand is a licensed clinical social worker with a Ph.D. from International University. He is renowned for his groundbreaking discoveries and advancements in the areas of healing trauma and enhancing performance and creativity. His Brainspotting method and biolateral sound are now used by thousands of therapists on every continent seeking to break through the limitations of talk therapy. Dr. Grand is the author of the book Brainspotting, the revolutionary new therapy for rapid and effective change and emotional healing at warp speed. In addition, he is the co-author of This Is Your Brain on Sports. Dr. Grand's clients include professional athletes, entertainers, business leaders, and survivors of profound trauma, including Hurricane Katrina, the 9/11 attacks, people who have served in the military in Iraq and Afghanistan as combat veterans. All of these people have sought out this powerful method as a means to realize the kind of personal, professional, and creative breakthroughs that they desire. Dr. Grand is a sought-after lecturer, performance coach, and public speaker. He has taught scene work at the New Actors Workshop and was privately coaching both stage and screen actors. He has presented seminars on his innovative methods and keynoted at numerous international therapy conferences. In addition to teaching performance and creativity seminars, he now spends months every year traveling around the world, training therapists on the use of brain spotting, and sharing his biolateral sound with professional groups of all kinds, including business, sports, the arts, and therapy.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.